Cause of cancer. Cancer is a complex group of diseases with various causes, often involving a combination of genetic, environmental, and lifestyle factors. Here's a detailed overview of the primary causes of cancer. 1. Genetic factors. 1. Inherited mutations. Some cancers are linked to inherited genetic mutations, e.g., BRCA1 and BRCA2 mutations for breast and ovarian cancer. 1. These mutations increase the risk of developing certain types of cancer. 2. Familial cancer syndromes. Certain syndromes, like Lynch syndrome, hereditary non-polyposis colorectal cancer, predispose individuals to specific cancers due to inherited genetic changes. 2. Environmental factors. 1. Carcinogens. Substances that can cause cancer, including chemical carcinogens, tobacco smoke, asbestos, benzene, and formaldehyde. Radiation. UV radiation from the sun, linked to skin cancer, ionizing radiation from X-rays or nuclear materials, and radon gas exposure. Biological carcinogens. Certain viruses, e.g., human papillomavirus, HPV, hepatitis B and C viruses, and Epstein-Barr virus, and bacteria, e.g., Helicobacter pylori, have been linked to cancer. 3. Lifestyle factors. 1. Tobacco use. Smoking is the leading cause of lung cancer and is also linked to cancers of the mouth, throat, esophagus, bladder, pancreas, and more. 2. Diet and nutrition. A diet high in processed foods, red meats, and low in fruits and vegetables may increase cancer risk. 2. Obesity is also a significant risk factor for several cancers. 3. Physical inactivity. Lack of exercise can contribute to obesity and increase the risk of cancer, particularly breast and colorectal cancers. 4. Alcohol consumption. Excessive alcohol intake is associated with several cancers, including breast, liver, and esophageal cancer. 4. Hormonal factors. 1. Certain hormones can influence the development of cancers, particularly breast and prostate cancers. 1. Factors like hormone replacement therapy, early onset of menstruation, late menopause, and reproductive history can play a role. 5. Immune system factors. 1. A weakened immune system, whether due to diseases like HIV, AIDS, or medications like immunosuppressants, can increase the risk of certain cancers. 1. The immune system plays a crucial role in identifying and eliminating cancer cells. 6. Age. 1. Cancer risk increases with age, as genetic mutations accumulate over time, and the body's ability to repair damaged DNA decreases. 7. Chronic inflammation. 1. Long-term inflammation, whether due to autoimmune diseases or infections, can promote cancer development. 1. For instance, chronic inflammation in the stomach can lead to gastric cancer. 8. Exposure to certain chemicals and substances. 1. Long-term exposure to specific chemicals, like those in certain workplaces, can increase cancer risk, including asbestos, linked to mesothelioma and lung cancer. Aromatic amines, found in dyes, linked to bladder cancer. Formaldehyde, linked to nasopharyngeal cancer. 9. Radiation exposure. 1. Prolonged exposure to certain types of radiation, such as UV radiation, X-rays, and radioactive materials, can damage DNA and lead to cancer. Conclusion: cancer is typically the result of a combination of these factors rather than a single cause. Understanding these risk factors can aid in prevention and early detection. If you have questions about specific types of cancer or risk factors, feel free to ask.